Good afternoon. My name is Elizabeth Poole, and I'm a part of Group One. And today we're going to be talking about Cancer Alley, Louisiana. Cancer Alley lies between Baton Rouge and New Orleans along the Mississippi River, including 12 parishes that extend 130 miles. It is home to over 150 petrochemical industrial facilities releasing consequential toxic pollutants in the air and water. Cancer Alley is also known as Death Alley or the Industrial Corridor because it has the highest cancer risk, highest clusters of cancer patients, and highest mortality rate than anywhere else in the state, and in some data suggests in the country. Cancer Alley contains approximately 4,500 residents, where 81% of the population is Black American. High poverty rates exist there, and, and residents are found to be economically challenged. There are other characteristics and qualities that Cancer Alley residents bring to the table. One being stability, because many of them are established and they've been living in homes that have been passed down from generation to generation. Strength is another, because residents can trace their lineage back to former emancipated settlers who founded the community. Resiliency is another one, because they've endured pollution and cancer for decades, and they have proven that they can unite and organize to fight for their community. Prior to being targeted for industrialization of chemical and oil processing, Louisiana was used for cornfields, sugarcane, indigo, and cotton plantations. Once slavery ended, many emancipated slaves worked as sharecroppers and built communities in what is now to be known as Cancer Alley. During the Reconstruction, the Jim Crow era, and segregation, redlining would segregate Blacks to the 12 parishes that map out Cancer Alley. After World War II, production of oil refineries started to boom, and real estate was needed to keep up with demand. Initially, oil refineries tried settling in predominantly white parishes, but residents had resources, and they were able to push back. So the oil refineries avoided those communities. Instead, they chose the path of least resistance and started targeting Black parishes. And between the 1950s and 1970s, oil refineries and petrochemical industries took over Cancer Alley. And by the 1980s, residents who lived in close proximity to them started recognizing increases in instances of cancer and miscarriages. Residents have long maintained that they are disproportionately impacted by cancer and other health problems from chronic exposure to industrial pollution, where residents are often left unprotected. Legislators and political leaders who make permitting decisions for the petrochemical industry have not taken corrective action because they do not validate disparities of adverse health outcomes. Even the environmental regulators aren't doing enough to limit and monitor the emissions. Now I'm going to pass it over to Neishana.
My name is Neishana Morrison, and I will be focusing on marginalized population of Cancer Alley. Now, the construction of these large plants has led to an increase in the chemical levels in the Cancer Alley corridor. In fact, they are recorded as 7 to 21 times greater when compared to areas that are occupied by predominantly white and also areas with similar infrastructural activities. Chlorophene, a known cancer-causing chemical, is also emitted in that area, and it reads at 3 times the permissible level. Now, greater health impacts are also associated with proximity to fossil fuel sites. And what we discovered is that not only are the areas closer to these fossil fuel and petrochemical sites occupied by predominantly Blacks, they are just about 0.5 kilometers to 1.5. The distance is just about that. Now, there are several health consequences that have resulted for these Cancer Alley residents. One, there have been increased hospitalizations and deaths during the COVID-19 pandemic that have been connected to the air pollution in that area. Toxic air pollution, along with social polarization, has also contributed to preterm births and low birth rates in that area. Other health consequences that have been borne by residents of the Cancer Alley area includes increase in asbestos-related deaths, respiratory complications as reported in adults, and for children, they've experienced nosebleeds, headaches, childhood asthma are just a few of the symptoms for those who are living there. And there's also many of them attending the Fifth Ward Elementary School, located very close to one of those massive plants. Another health consequence for residents living within the Cancer Alley area is that they are at a higher risk for developing cancer from air pollution. In fact, the residents in that area are 47 times it's 47 times greater a risk of developing cancer than others in other areas. Last but not least, as we know, these fossil fuel industries contribute to air pollution, but there's also the matter of land pollution and water pollution. Water pollution renders drinking water unfit for human consumption, and also the presence of heavy metal can contaminate fish that when it's consumed by humans, it can prove unsafe for consumption. Alex, over to you.
Hi, I'm Alex, and I'm going to be speaking a little bit more on human rights in Cancer Alley. So in 2022, Cancer Alley was declared a sacrifice zone, noting to be the worst imaginable dereliction of a state's obligation to respect, protect, and fulfill the right to a clean, healthy, and sustainable environment, making Cancer Alley a direct violation of human rights. Even with international eyes looking towards the United States to make improvements to Cancer Alley, Louisiana has not acknowledged their mistakes or made reparations for residents. Access to stable health is defined by many global organizations and declarations, including Article 25 of the Human Rights Declaration, but is being overlooked in Louisiana. Though the United States Environmental Protection Agency has the ability to significantly limit the pollution levels in Cancer Alley's factories, they have denied pollution rates and the long-term health impact that Cancer Alley has had on residents. This challenges a social worker's ability to create change and to put resources toward the affected population when they lack governmental support or funding for the issue. And since its existence, residents of Cancer Alley have not had a voice in controlling what businesses reside in their neighborhoods, which would likely not be the case if Cancer Alley was in a more affluent or less rural area. Activist groups like Human Rights Watch have directly called out Cancer Alley's industrialization for discriminating on the basis of race and targeting their businesses in areas of segregated, impoverished Black communities that do not have the means of combating expansion. Segregation alone can lead to major health problems, but with Cancer Alley producing such increased pollutant rates, cancer rates are much higher compared to other areas of segregation in the United States. Many petitions have been filed against the EPA and Louisiana's Department of Environmental Quality, but they've been denied. But one of the more successful cases occurred recently in 2023, where Earth Justice, on behalf of 7 local nonprofits, aimed to expose the creation of sacrifice zones in the St. James Parish. The EPA did agree to conduct research regarding the complaint after a judge noted that the benefit of the plants definitely did not outweigh its environmental impact. However, Louisiana's former Attorney General countered the EPA's ability to investigate racial discrimination, saying that pollution does not discriminate. However, as of recently, the EPA has announced stricter regulations around cancer-causing pollutants, which could improve Cancer Alley's current state. Resistance against the impact of industrialization on health and climate is being pursued by local human rights advocates and international organizations like the United Nations and the World Health Organization. By funding and dedicating time to fighting the cause, advocacy groups have a greater ability to invoke positive change with the greater number of voices speaking against Cancer Alley than the residents have opposing these injustices alone. I'd like to pass it to Verity.
Hi guys, I'm Verity, and I'm going to talk about the perspective of social work and how social work has engaged this issue. So we mainly researched the NASW, the IFSW, and the AASWSW. So I will be discussing those primarily. First, the NASW does not make many comments on environmental justice. In fact, I was not really finding much other than the fact of social justice, and that we should be having that as a value and a standard for social work. But that's about the closest it comes to addressing environmental racism. The NASW Louisiana chapter does not make any comment at all. I reached out to them via phone call, and they did not respond, shockingly, especially considering that they are located in Baton Rouge, which is the tip of Cancer Alley. The AASWSW is the American Association for Social Work and Social Welfare. They call for interdisciplinary collaboration and transformative solutions. They call for social workers, psychologists, policymakers, healthcare providers working together and coming up with solutions that call into question power structures that are currently in place. And then the IFSW has the Climate Justice Program, and they, in their Climate Justice Program, call for education, advocacy, and being the change that we want to see is in relation to humans and the tendency to have a destructive nature on the environment. So those were the broad comments from the organizations. Nobody really specifically addressed Cancer Alley. We were looking at macro, meso, and micro practice as well. So with macro practice, we would like to see the U.S. consider things such as the International Covenant on Economic, Social, and Cultural Rights. And this covenant affirms the value of human life. So this would be something that we would like to see policymakers bring about. At the meso level, we discussed wanting to help the community see the problem as a public problem, not just a private problem, because there are other places that do experience environmental racism in the same way. So the problem is not just a private problem that each individual resident deals with. It is a public issue that needs to be addressed. And then on the micro level, we discussed the person in environment framework, being how social workers should view residents. The person in environment framework says that the social worker should look at the entire environment and how the person relates to those, and it addresses things even such as nature and how nature can be a stressor or a benefit. And in this case, it would be a stressor to the residents living there. And so that should be considered when dealing with clients of Cancer Alley. So that would be added into the assessment in micro level practice. And then our perspective pretty much aligned with everything that we've said so far. So we also agree with the needing to talk to legislators and change policies. And then at the meso level, we would definitely like to, we were shocked to find out that the NASW Louisiana chapter didn't say anything. So contacting them and making them aware. And then on the micro level, things like health professionals are lacking there. So just helping to find more of those resources, and then bringing it back up to Pennsylvania. And in Pennsylvania, just calling out those places where environmental injustice exists also. Thank you. And then our resources.